Okay, that sounds great. Well, happy Menstrual Hygiene Day, everyone. Welcome to the Menstrual Health One-on-One for Grown-Ass Women workshop and panel discussion. This experience is brought to you by the House of Women Wellness in collaboration with the San Diego Lactation Equity Alliance and the San Diego Breastfeeding County Coalition. My name is Imari Nickerson Wright. I am the founder and visionary of the House of Women Wellness, as well as the San Diego Lactation Equity Alliance Board President. Joining me today and facilitating is Sharday Bell. She is the owner of Melanin Milk San Diego Collective and the executive director of the San Diego Lactation Equity Alliance. I am overjoyed to introduce to you today our lovely panelists for today's discussion. These women are inspiring, insightful, and intuitive. We have Dr. Kelly Elmore. She is a board certified obstetrician gynecologist with over 26 years of service in the U.S. Navy. She is a healthcare executive, a published author. She has led major medical centers, including Walter Reed National Military Medical Center and Naval Medical Center, San Diego. Dr. Elmore specializes in health equity, diversity, and advancing healthcare operations. Through Viva Life, she promotes holistic well-being across spiritual, physical, financial, mental, and emotional dimensions, encouraging individuals to thrive. We have Dr. Shani Cooper. Dr. Shani is a doctor of acupuncture and Chinese medicine, a full spectrum doula, a certified lactation educator, and a champion of empowered bodies and empowered births. For over a decade, she deeply immersed herself in exploring the gut-brain connection, the innate wisdom of the menstrual cycle, and the ways our modern bodies continue to carry ancient patterns. From menarche to menopause, through fertility journeys and postpartum healing, she empowers individuals to decode the messages their bodies are sending and to respond with the care and support they truly need. She has traveled to China and Tibet to study with masters and built a practice where 5,000-year-old medicine meets modern day science. She doesn't just teach this stuff. She has used this work to navigate her own fibroids, painful periods, and miscarriage, and to nurture her body to conceive naturally at 38. Unfortunately, Ashley Murdoch, mindful living coach and owner of Hello Wealthy, is unable to join us today, which leads me to our final panelist, Noemi Delgado. Noemi is a massage therapist and doula whose work focuses on preserving and uplifting ancestral medicine. She was initiated into caring for pregnant and birthing people by traditional midwives in her paternal homeland, El Salvador. Her work has since expanded outward to supporting people through all stages of life as a certified massage therapist. She believes that healing can only happen in community, and that is why her practice is grounded in reciprocity and relationship building. Thank you all. We are so honored to have you join us today. Before we get started, I would love if we could just take a moment to arrive and align. Please know you can take as many breaks as you wish. If anything feels triggering to you, please feel free to leave and return. You have ultimately full autonomy over your body, so this is just for educational purposes and recommendations. Let's take a deep breath and get started. As a grown-ass woman, are you confidently able to answer the following? When was the first day of your last period? How many days did your period last? Where are you currently in your cycle? And how many days is your cycle? The goal of this presentation is not only to answer these questions with confidence, but to be deeply attuned and connected with your body, with your cycle, therefore making choices that aligns with your needs. The following topics are what we will be covering today during our presentation. What is a period? Phases and lengths, flows and postpartum periods, cycle supporters, stressors and concerns, wellness remedies, and products. So, what is a period? Menstruation, also known as your period, is when your body releases the monthly buildup of the lining of your uterus. This part of your cycle is not the entire thing, it's just the start of it. Here we have a closer look at the menstrual cycle. First, we start with menstruation, then lead into the follicular phase, which goes into ovulation, and then our cycle finishes off with the luteal phase. Do you mind scrolling up to the follicular part, Sade? Thank you. We just covered menstruation, but the follicular phase is all about maturing the egg that is released during ovulation. It is the longest part of your cycle, and you are fertile during this time. Ovulation occurs when the mature egg is released from your ovary. This will occur between day 12 to 16 of your cycle, depending on the length of your cycle, and you are fertile a few days before and during ovulation. The luteal phase is where your body either prepares for a pregnancy or prepares for menstruation. Your period can last from 3 to 7 days. Your cycle can last every 21 to 35 days. These numbers are just averages, and your flows can go between heavy, moderate, or light. Know that your cycle starts on the first day of one period and ends with the first day of your next period. But month to month, your cycle, your period, and your flow may change due to circumstances. Here we have products that are available to us during our period. It is recommended that you change your pad every 4 to 6 hours, depending on your flow, changing your tampon every 4 to 8 hours, but never longer than 8 because of the risk of toxic shock syndrome. It is recommended to wash, empty, and reinsert your menstrual cup every 12 hours. Depending on your flow, it may have to be done more frequently, every 6 to 8 hours, to prevent leaks. For menstrual discs, they can be worn up to 12 hours, but again, depending on your flow, it may need to be more often. Period underwear can be worn for a full day and may be changed more often depending on your flow as well. And free bleeding is where you just choose to use nothing. You just allow your body to bleed out naturally. Postpartum periods. So, when you are a postpartum mom, it may take months to weeks to return. Your period may take months to weeks to return, but you still can get pregnant during this time. If you are breastfeeding, this will increase your prolactin and can suppress your ovulation, which means your period will temporarily be absent, but again, you can still get pregnant. And because of your body just giving birth, your period may be irregular, it may be lighter, and it may be heavier. But since you are healing, it is recommended that you only use pads. There are many conditions that can affect your period, but a few that we have listed here is PCOS, which stands for polycystic ovarian syndrome. We have endometriosis, uterine fibroids, and ovarian cysts. There are a lot of things that you can incorporate during your cycle that can support you, and there are also things that can stress you out. Really, please stay hydrated. Make sure you're checking in with your doctor. Tracking your cycle can give you a little peace of mind as to what to expect and what is going on with you. Changing your pad or your tampon or whatever your choice, change it as often as possible. Make sure that you keep your products as natural as possible. Avoid scented things if you can. Also, wearing breathable clothing and relying on the resources available to you will also help support you during this time. Some things that can stress you out is just truly trying to pour from an empty cup, not getting sleep, not knowing where to turn to if you have questions, ignoring pain, pushing boundaries, and shaming yourself for what you are going through at the time. Wellness is essential while bleeding, taking care of yourself during that time. You can do this by resting, you can do this with movement, and you can do this with nourishment. You don't have to do these things all throughout the month, but it is nice to treat yourself to these things while you are on or when you are on your period. Unplugging and doing nothing and resting are ways of rest. Aerobics and light walking, doing some yoga or hiking are some ways that you can get your body moving during this time. And nourishment, warm foods, warm teas, iron-rich foods, foods that are really rich in vitamins because you are shedding and releasing so much during this time. It helps replenish what you're losing. These are some natural remedies that you can incorporate during your period. Nettle, red raspberry, ginger, and chamomile are all herbs, and they make really great teas during this time. And cycling with the seasons is when you will reference your period in the rest of the phases to mirror the four seasons. So the menstrual phase will be winter, the follicular phase would be spring, ovulation would be summer, and the luteal phase will be fall. When to be concerned, if you are experiencing extreme or unusual pain, if you are bleeding longer than 7 days, if you have an unexplained missed period and you are experiencing heavy bleeding, it is recommended that you immediately contact your primary care provider and get to the bottom of what may be going on within your body. Ultimately, it's very important to give yourself grace during this time. It is powerful to know that our bodies are operating on a 28-day rhythm opposed to a 24-hour rhythm that a man experiences. So, our cycle is not a problem to fix. It is a time where you can really grow and connect deeper within yourself to listen to what your body needs. So honor your energy, protect your rest, and respect your rhythm. These are our references for all of the information that was just shared in the presentation. And now it is time to hear from our lovely panel of experts.
Thank you, Imari, for that presentation. Um, the contact info for the panelists and the organizations involved in today's webinar are here. I'll put this back up on the screen after our panel is concluded. Okay. So we're going to start off with Dr. Kelly. We have a couple of questions for you, and then we have our Q&A available to those who are in attendance today. If you have questions for any of our panelists, feel free to put them in the Q&A and we'll do our best to get them answered for you. Mari, would you like me to start off with the first question for Dr. Kelly, or would you?
Yes, that would be great. You can start.
Okay. Dr. Kelly, hello. Um,
Hello.
Would you like to say anything first before we get started on our first question?
Just want to say thank you, everybody, for allowing me to be here. Thank you for coming on. I wish I could see each one of you because I like to be really interactive with people, but please go ahead if you have any questions, drop it in the chat, and I'm here to serve.
Okay, so our first question is, how does your overall health, things like stress, nutrition, sleep, or medical conditions affect your cycle?
Well, if anybody knows me, that's this word you see up there, Viva Life SPF Me. So it's all about helping you live your healthiest and wealthiest life spiritually, physically, financially, mentally, and emotionally. And the 5 things that we focus on are doing your meditation, your journaling, your exercise, optimizing your nutrition, your hormones, and your sleep. So that being said, I think I may have answered that question, but your sleep patterns, your hormonal fluctuations, the amount of stress that we have, and the amount of stress that is seen and unseen all affect your cycle. And I want everybody to understand that we have cycles. We are cyclical people. We are cyclical women. So we don't have the same amount of hormone flowing through our body all throughout the month. And when she was explaining all of those 4 phases of menstruation, that is because we have estrogen and progesterone and testosterone that are elevating and lowering throughout the month so that we can have this cycle. It is very normal for us to do that. Everybody doesn't cycle the same way, and that's okay. However you are set up, we are here to support you. So one of the things that people talk about is something called weathering, which is basically how socioeconomic status, as well as racism, implicit bias, all cause us stressors, along with the other things that we have in our lives, our jobs, people around us. And, if we are not able to manage those well, and if we don't have the resources and tools to do that and the support, then our period, our cycles will be affected by that as well. Thank you. And I have time that we can go through and weave everybody else in. Just to let y'all know, we have time to weave everybody else in because we have some really dynamic women on the phone, or excuse me, on the panel with us. So we want to make sure that they get into.
Awesome. Thank you so much.
Yes, thank you, Dr. Kelly. Our next question for you is, what are some red flags when it comes to period pain, heavy bleeding, or irregular cycles that people should never ignore?
So I think, the red flags, I believe you mentioned those. Essentially, once you figure out, and I'm going to say, once you figure out what your cycles are like, if it's outside of the norm for you, especially after 1 or 2 cycles, which typically we put as 1 or 2 months, if those are outside the norm for you, then we need to bring that up to our provider, whomever your provider is. That can be your primary care, it can be your OBGYN, it can be your chiropractor, your acupuncturist, can be your doula if you have a doula. So we want to make sure if it's outside of your norm, then we want to know about that. When we're in our adolescent phase, when our body is first starting to understand what it is doing with our cycle, you're probably going to have that question or those conversations earlier on. So if you're with a pediatrician or a primary care or OBGYN, when you're going through your adolescent phase, then we want to have those conversations earlier on. The reason being is because, one, we want to educate you on, what should you expect before you even get there. And then once you're in these phases, we need to understand, what is your baseline pain level? What is your baseline mental health, mental health and spiritual health at that time? What emotions are you going through? So we know and we can document, okay, this is what's normal for you and this is what is not normal for you.
Thank you. You mentioned acupuncture, so I'm going to go over to Dr. Shani. Dr. Shani, how can acupuncture and herbal remedies support hormone balance and ease menstrual symptoms?
Great question. So one of the things that really brought me to Chinese medicine was honoring this idea of bringing the body back into balance, because obviously if we're feeling balanced, then it's easier to flow through life. And really a lot of the signs that sometimes come up, especially with a period, it's sometimes like, call it the canary in the coal mine. They can really be an indication of what is happening systemically, because we have this regular cycle that's supposed to show up a certain way. It's supposed to be regular. It's ideally supposed to be pain-free. That's the way Chinese medicine looks at it. So when I start seeing pain, I start looking for where is the stagnation happening in the cycle and the system, and where can we get things to flow a little bit easier. So with acupuncture alone, we can definitely do a lot to kind of bring the body into rhythm. But I also do a lot with herbs, especially as teas, things that are really easy to add into someone's routine, so that there's already an element of slowing down, right? When you think about sitting down to a cup of tea, you automatically think about slowing down your pace as opposed to being on the go. And also, where did pharmaceuticals come from? They originated with plants, and some plants, a lot of formulas that I use have been used and tested for thousands of years. And there's a lot of really great research to say that, hey, it can help with painful menstrual cramps. Hey, it can help when we're seeing these signs that say, you know, back pain and PCOS and bringing hormones back into balance. And we'll actually we'll actually see how just catabolizing, breaking down cortisol, which is the stress hormone, which a lot of us have heard of, bringing those levels down naturally in the body can go a long way in the amount of interfering with the menstrual cycle that we can sometimes see stress do. So I always tell people, if nothing else, acupuncture improves circulation. And when we improve circulation, especially in someone who bleeds on the regular, we're always going to see a smoothing out of the cycle and a gentler monthly experience.
Dr. Chani is an amazing acupuncturist. I just want to say that because I personally see her, and she is amazing, and she works wonders for folks that are in all phases of life. I hear that word stagnation with her a lot. So I do want to ask more if you can talk about that. And another follow-up question that we have is, in Chinese medicine, what is the color of your period from bright red to dark brown? Tell us about what's going on in the body. And when you said stagnation, I immediately thought of those things because you have taught me a little bit.
Yes. So stagnation is one of those words that doesn't get used a lot in our everyday language. But the second I heard it, it just made sense. We're getting stuck, right? The blood isn't flowing. And a lot of times we can see that in a period that maybe pauses in the middle of the bleed. Like sometimes you're flowing 2 or 3 days and all of a sudden you're like, "Ooh, is it gone?" And then it comes back with a full flow for another day or two. That's a loud sign of stagnation. We will typically see stagnation in a body that is prone to fibroid growth. In a abdomen that's cold. One of my favorite tricks in the clinic is taking a patient's hand and saying, "Do you feel the temperature difference between above your belly button and below your belly button?" That's a true sign that there's cold. And what does cold do? It slows things down, it constricts, it tightens, right? And it can make pain worse. So if we know we're prone to that, we can let add some lifestyle things in, warm teas, warm around the menstrual period and leading up to it in general is always a good sign, a good thing to add in. When it comes to menstrual blood color, that's another thing that I look at a lot because it also tells me how well things are moving. If when you're seeing that brown at the beginning, that's typically old blood from the last round. And then we start to see that flow. Okay, that tells me, okay, we didn't quite finish. I wonder why we didn't finish if we've been holding on to that blood, because it's not usually, when you think about the body holding on to things, it's usually not a good idea, right? That's when things don't flow, that's when we can tend to grow things that aren't supposed to be there. Or is it dark red? Is it a dark purple red? Versus just a dark red. That'll cue me in. Okay, should I be looking for more cold signs? Because we see that dark purpley, bluish color with more cold versus bright red, like fire engine red, is going to be indicating more heat in the system. And again, Chinese medicine, we're looking at all of these things to say, where's this perfect balance, right? You think of that yin yang symbol with the yin and the yang and the yang and the yin. That is all of Chinese medicine. I really think it's a really good analogy for life, because when everything is in harmony, then everything flows, right? We don't snap at our loved ones as much. PMS, right? We flow through life. We can take a couple hits and be like, well, that wasn't optimal, but we gonna keep moving forward, or we're better at holding boundaries, right? And that shows up in our body. If we're bleeding earlier than we normally bleed, that's going to usually mean that either we're so exhausted that we don't have enough to hold things in place until it's time, or it means that there's too much heat moving things too fast and too willy-nilly. And if we allow these things to happen over months and months and months before we say anything to anybody and get these things addressed, that's how we end up in trouble and say, oh, well, where did these fibroids come from? And I can often walk us backwards, sometimes a decade. That was my case. And that's what brought me to this medicine. It was like, oh, all of a sudden it made sense why I was growing these things and why my period was painful. And through some lifestyle changes, I was able to make differences. And the same with my patients.
Thank you. Imari, would you like to ask a question of Noemi?
Yes. Thank you so much for that lovely explanation, Dr. Shawnee. Noemi, my question for you is how can body work and movement help with cycle-related pain, tension, and trauma release?
Mm. Yeah, I love what Dr. Shani is saying about things being in flow and this concept of stagnation. And I think that one of the biggest ways that body work can support folks throughout their cycle is creating more of that flow and yeah, sort of being like a protective measure against stagnation, because when you're experiencing massage, for instance, you're actually moving blood and moving lymph so that things can flow more freely. And I like to think of body work as a really effective way of communicating with the body. We can obviously also talk to our bodies with words, but sometimes touch is one of the best ways to communicate with our bodies and let them know that it's safe to let go, and that, you know, they don't have to be holding in certain places and in certain ways. And so massage and body work, different kinds of body work, are a really great way to create that container for the body to feel safe to begin to let go. And then with, you know, consistent body work, whether it be going to acupuncture or massage therapy, or even just having a loved one give you body work. It could literally be something as simple as a foot rub or a back rub. We're training the body to feel safe in letting go and allowing this flow. And yeah, and the uterus itself, it is, you know, held up by a bunch of different ligaments. And sometimes those ligaments can get tight or out of balance. And so specific kinds of massage, for instance, womb or abdominal work, can help to loosen these ligaments, can help bring them into balance, which can physiologically support a painful period. And yeah, I think that's all I have to say about that right now.
Thank you, Noemi. I was just getting ready to call on you, Dr. Kelly. Do you have something to add? And then we do have a question for you of kind of around that same topic of exercise and movement. What should folks know about exercising before, during, and after their period, or, you know, in the postpartum phase, or when their hormones are shifting?
Yeah, no, I absolutely agree with Noemi and Dr. Shani and what they were saying in regards to, you know, understanding where you are in your cycle and understanding how to utilize massage therapy, acupuncture, as well as herbal teas to help you through those different phases. I did want to go back to the idea of pain in your cycle, because the initial time that most people feel pain in their cycle may be when they're first starting to have their period, and really trying to understand what that means. I will be honest with you. I would say more than 90% of young ladies that begin their periods that I've met have some sort of pain. Okay. Now it can be very dull, you know, achy type of pain. And the reason why is the uterus is a muscle and it's contracting. And it took me a long time to really realize this, even after I was a physician, but the uterus is a muscle and it's contracting. And we need to understand, okay, why is this contracting? Is this out of the norm for me or not? But if you're experiencing significant pain, and nobody wants to see a young woman in pain, nobody wants to see that. But the first thing people want to do is give you a Motrin, a Tylenol, or put you on birth control pills, right? And so then what happens is people have masking of the pain until they get to be older or stop taking the different medications, whether that be, you know, whatever medications that they're taking. And then they come on later in life. And then, like Shani was saying, then you have fibroids. 60 to 80% of women have fibroids. And I would say more than 80% of women of color have fibroids that start very, very, very early or in midlife. Their 20s or 30s, and it's being masked because we're using these medications, and some of those medications actually feed your fibroids, right? Even though it manages the blood flow, it feeds the fibroids. So I just think that is one of those things where we talk about understanding your pain tolerance, your pain levels, and what you're able to when you're going out of your baseline. The other thing is shortness of breath, nausea and vomiting. I mean, I remember my god sister, she used to stay home from school because she was in significant amount of pains, which is another reason why they put her on birth control. But, understanding that, no, we should not be having that. But we also need to think as providers, what are some of the other reasons why this child is in such terrible pain, or this young woman is in such terrible pain? I think that's really important. You can have headaches associated with your cycle. So there's all types of things that your body is telling you during your cycle. And it's really important to understand, what is the root cause of that's potentially going on, and getting away from us just masking it, and really trying to understand the basis of that and what are some alternative therapies that we can utilize to help with that. So that's just the one thing I wanted to add there.
We also had a question about the panelist Ashley that was supposed to be here today was going to talk just kind of briefly about her experiences with endometriosis. So can you kind of just give us a brief explanation? We hear that word a lot, and I don't think a lot of people know exactly what it is or what it means. What is that in terms of pain, and what tools or routines could be helpful in something like a diagnosis or a condition that would cause pain in your cycle?
Yeah, so endometriosis, essentially, so when you menstruate, this is one of the things I also realized as I, went through my training. When you menstruate, not only do you bleed and it comes out through your vagina, but it can go out through your tubes, right? Because you have fallopian tubes, they are open. That's how the egg comes into the fallopian tubes, meet the sperm, and then they deposit into the uterine lining, right? But that blood flow goes down through the vagina and it goes out through those tubes. So the thought is that that blood flow that's going out in those tubes, there are cells that are associated with that. They attach to different organs on the inside of your body. It could be attached to your ovaries. It could be attached to your tubes. It could be attached to your uterus. It could be attached to your bladder. Anything internally, it could be attached to. And when when your hormones are talking to those cells, which remember they're originally from the uterus, whenever your hormones are talking to those cells, you can get triggers causing that pain. Those cells are either causing scar tissue to form, or they're sitting there and there's masses that start to form there. And that can cause you to have pain. And that pain does not actually have to be while you're on your period. It could be anywhere in that cycle. Remember, we talked about having the different phases. It can be anywhere in those phases. That pain or that endometriosis, like I said, can cause scar tissue. It can cause your tubes to clamp down. People have fertility issues associated with that. And then also people can have pain with intercourse, working out. It just can flare up at any time. So endometriosis is different from, people say, well, endometrial cancer, that's different. Endometriosis is different from your menstruation, but it can be associated with the different types of your times in your cycle, and it can really, in some people, wreak havoc, and in some people, they have that backflow or those cells growing in different areas and they don't have any type of abnormality associated with it. So everybody is a little bit different associated with endometriosis. And I'm sure my colleagues can probably give you some of their perspective as well on how they've managed or seen it manifest in different women.
Yeah, I was definitely going to ask Dr. Shani and Noemi as well. Is there any experiences that you have had with clients or patients experiencing endometriosis, and what that looks like for you in terms of treatment and support I think we could probably, Imari and I talked about this, we could probably do a whole nother webinar or a series on this, on the different things, because as we started getting into the basics of it, we started to break down all these other topics like what is endometriosis? What does that look like? PCOS, what is that? What does it look like from person to person? And so I think that might have to be a follow-up series that we do. But Dr. Shani or Noemi, is there anything that you want to add to that question about endometriosis?
I'll just add, this is, one of the biggest things that I think, Dr. Kelly, I really want to piggyback on is understanding your normal when your normal changes. Because a lot of times what I've been seeing recently is folks who are coming and saying, hey, I don't know why I'm finally ready to get pregnant and it's not happening. And in the course of trying to figure out the why, what is the root of this problem, we discover, oh, you have endometriosis. And maybe now that it's gone untreated and unchecked for this, for a decade or however long, now it's creating issues when we're trying to create life and put a bun in the oven, right? So a lot of the things that this is another one of those Chinese medicine really kind of brings things down to the, while we definitely treat endometriosis, we see a lot of it as, again, stagnation. How can we improve blood flow circulation so that we're not getting as much tissue growth outside of where it's supposed to be? How can we calm the muscle tissue during the menstrual cycle when it's creating that contraction to reduce the pain and create optimal blood flow to the uterus without being in excess?
And if anyone that's attending today has any questions for our panelists, feel free to put them in the Q&A as we're talking. We'll be sure to get those questions answered. And it looks like Dr. Kelly also dropped something. Oh, good. Thank you. An ACOG link for endometriosis in the chat. So feel free to just put your questions in the Q&A and we'll be sure to get those answered for you.
So what I dropped there was acog.org, and I'm sure Shani and Noemi have kind of their, their guiding bodies that you can go to. But I love to send people to acog.org. You can ask any women's health question. It has the medical perspective. I'm just letting you know. But at least it's a, vetted resource of medical perspectives. So I tell everybody, keep acog.org on your phone and go ahead and ask it whatever questions you need to, along with ChatGPT and cdc.gov.
Yeah, I know it's medical based and it's evidence based, which is great, scientific, but it is good. I do refer to it a lot for a lot of different reasons. So that is a great tool. Thank you for sharing. A lot of people I feel like do not know that there is so much helpful information on there with regards to women's health. So it's a good starting point at least. Noemi, did you want to add anything about that? If not, we have another question for you.
Yeah, I'll just piggyback off of what Dr. Shani was talking about, just really understanding your period and your menstruation as an opportunity to tune into what's going on with your body. And so kind of learning the language of your period and like she said, knowing what normal is for you. So if all of a sudden your cycle is shorter, trying to think back through that last cycle, what might have changed for you during that cycle, what habits were you maybe doing or not doing that might have affected your cycle. Like if your period is much heavier one month or much more painful one month or much lighter one month, trying to kind of keep track of what factors may have contributed to that. Were you eating differently? Were you sleeping differently? Was there a major stressor in your life? And just starting to kind of honor your cycle in that way by really paying attention and and trying to prevent things before they get to a state of needing to be treated with more intensive care.
I think one of those other things you mentioned, the nutrition piece. I know that changing your nutrition during your cycle, because your cycle is going to actually tell you what it wants to eat, right? And we just have to be careful that we don't, stay into, for example, during certain times of the month, you're going to want to have carbs. Okay, great. Well, how can we find the healthier carbs that we want and crave, right? And not linger into the next part of the cycle and still be on those what we wanted to do the last part of that phase, right? And I will be honest with you, like my PMS was crazy. Granted, I was in residency and married and having kids, all that other stuff. But my PMS is crazy when I'm not eating clean. When I'm eating clean, meaning fruits, vegetables, nuts, grains, beans, drinking my water. When I am not doing that, my emotions, my ability to tolerate, my resilience, all of that, all over the place and down. So I automatically know not only is it going to help my cycle, it's going to help my interactions with other people, and it's going to manage my weight, right? As well as my health overall, the diabetes, the hypertension. I'm not going to have that because I'm doing what I need to do during different parts of my cycle, but also focusing on eating as clean as possible not just during my cycle, but during my cycle, not just during my luteal phase or, menstrual phase.
That is great advice. I will be sure to take it.
If I could piggyback on that, because it's sneaky too. I remember the first month I decided, okay, I was advised that dairy was not my friend, and I already knew dairy wasn't my friend, but I love cheese. And I just decided, okay, this month I'm not buying any cheese. Let's just see what happens. And it was a night and day difference between my menstrual cramps from the cycle before and the next cycle. So truly not just, this is why I love cycle syncing your life. Knowing where you are and when, okay, I'm having this craving. Oh, that makes sense. I understand now. Now I can make a wiser decision. The other thing, so you keep yourself out of trouble. Don't be committing to things during your ovulatory period that you're going to do during your luteal phase and run out of steam because your menstrual phase is coming up. Now you got to cancel plans. And yes, sometimes that's a definite thing we need to do. But if you know you're making that commitment because you're during your ovulatory phase, which typically we feel stronger, we're yes to everything. Yes, girl, I'm going to be there. And then all of a sudden, a week and a half later, you're like, ooh, I don't know why I just don't want to get out of bed today. It's because you probably should have checked your app before you said yes, and maybe put it like maybe in 4 weeks, girl, I'll see you, as opposed to, overcommitting. Because when you honor that time and that energy, you're also honoring your inner spirit. Because we all know, especially those of us melanated in this world, we are not resting enough, and we feel guilty when we do, even when it's absolutely our birthright to rest. So make sure you're like, oh, look, my luteal phase is coming up. How can I get a little bit more spacious in my commitments as opposed to constantly going and going? Because even that energy can change your relationship with your cycle and your womb, which can change your relationship, yes, with the outside world. Because nobody wants a snappy and a mess out in the street because I'm tired and I shouldn't have said yes to this, right? So it's just my little piece.
That's all making a lot of sense now.
I
You
mean,
just,
dropping the knowledge, I'm sorry, but I didn't realize that when I was in my 20s. And as you mature, you all are, I don't know what age group we have here, but you're getting information that was not given in your 20s and 30s
mm-hmm,
historically,
mm-hmm.
And of course, when you're working these 9 to 5s, these 12-hour shifts, these, whatever you're doing, prior Navy, there was no way that you could be like, well, my period. I'm just not feeling, I'm in my luteal phase right now. There was no way. But you can do things outside of your work so that you don't overtax yourself and everything like that. So you're giving me life, Dr. Shani.
And you had mentioned apps. That is one thing that's great about, today's modern technology and world. There are a ton of apps now that track your cycle and tell you which phase you may be in, depending upon the information that you put in there, given that is correct, right? And so that is a great tool that we have available to help you track these things. Because immediately when you say all these things, I'm like, oh, I have to do all this, but they have ways to make it easier for you to do that. So I think that's really helpful to know. And I think we don't talk about nutrition enough during our cycles, like you had mentioned, Dr. Kelly, and I know Dr. Shawnee is big on that as well. And so I think those are great things that we can all walk away from, that we can start doing, rather immediately and don't cost us anything and can kind of stick with us. So um, I think another question we have while we have Dr. Kelly still. This question I think can be for either Dr. Shawnee or Dr. Kelly is what does it mean to treat the menstrual cycle as a vital sign? And how do you approach that with your clients?
I think that's such a great statement because in GYN world, our first question is, how old are you? How many children have you had? When's your last menstrual period? Those are the first three questions that every GYN is going to ask,
Those
right?
are the
And people are like, why
questions.
do you keep asking me these questions? Because it really is a vital sign. Because as we were just saying, even without a tracker, and I wear my tracker all the time, even without that, if you are in tune with your body, mind, body, soul, and spirit, if you are in tune with yourself, you are absolutely going to know what is going on and what is right, what's out of the norm for you, and when you need to address those things. So I do think it's a vital sign. I do think it's very important to always understand when a woman or a person that identifies as a woman, what their last menstrual period is, and know where they are in their cycle. Not to degrade or demean them and say, oh, it's just your period. Like, we're not doing that. But we are acknowledging that there are things that happen in your cycle that we need to be aware of. There's signs and there's symptoms that are going on. And me as a treating physician, I need to understand that because there are certain things that I'm going to recommend during certain times, and there's certain things I'm not. There's certain tests that I'm going to look differently at. There's certain tests I will not do during a cycle, that I need to be aware of, right? So I do believe that just like they've put your blood pressure as a vital sign, your heart rate, all of these things potentially change during your cycle. And we need to know where that is. And you yourself need to track that and look at that and look at what is your data telling you so that you can make informed decisions. This is all about making informed decisions about your body. Naomi looked like she was going to say something, but I know you also asked
Oh,
Dr.
I
Shani.
was gonna say yes. Does anyone else that's knowing me or Dr. Shawnee have anything you want to add?
No, I was just listening intently.
I was just gonna say I think I really it's funny because y'all for a minute I wasn't gonna do women's health. But the more I started to think about the menstrual cycle as a vital sign, the more I realized how much a lot of us didn't get educated on all of this and how it could change paradigms if it was more than just, oh, I'm trying to get pregnant. Let me look at my cycle and figure out what's going on. What if you're not trying to be pregnant? What if you're just trying to move through your life and just recognizing that um, there's so much that they've discovered. I was just reading a research article where they're starting to say perimenopausal hormonal fluctuations can start as early as 35. Well, if you know that's what it is, and you've spot it first, then now you can have a different conversation with your healthcare provider, as opposed to saying, "Wow, no, it's just whatever," and I'm just going to keep grinding. Um, because it is your body's way of saying sometimes, hey, we're doing the absolute most and a little bit too much. Um, and we need to be paying attention to these things because it like I said, it's the canary in the coal mine. It can be the first sign because it shows up every so often because of its rhythm and its pattern. And if you know your rhythm like the back of your hand, because we pay attention to a whole lot of other things. We pay attention to our partner's rhythm sometimes more than our own rhythm. Sometimes that's for everybody's safety, but same, right? We're trying to move through this world and it's going to impact how you interact with each other. So being able to say, hey, that's weird. I'm normally 28, 29, 28, 29, and this time I was 31. What's that about? I actually had a patient come to me and she had really heavy periods, but this last one was surprisingly light and she didn't know why. And I said, wait, I'll stop. It would make me feel a whole lot better if when you went home tonight, you went and got yourself a pregnancy test. I know that's our goal, and I'm not saying this anything to do with me, but this is a real sudden shift. And sure enough, she texted me later that night and said, "You were absolutely right. I'm pregnant." Now she was still bleeding, and that was a different conversation. But because she noticed that difference and we were able to discuss it, we could say, this is not your norm. This tells us something else. And so if we can have that information, then we can have better conversations and be a part of our care plan and our care discussion, as opposed to feeling like we're not being heard because we're not having the right conversation.
And I would say, Naomi, you can probably testify to this, or tell us this. I mean, even in massage therapy, you notice a difference depending on what time of the month it is, right? Whether you're doing a massage, whether you're getting a wax done, the sensitivity levels change based on your cycle, and that's really important to be in tune with, as well. Just like you said, a lot of people know their fertility changes based on the mucus that changes in that comes out of their vagina when they're during a certain type of cycle. It's so important to know thyself. And somebody had mentioned people don't like to use trackers because of Big Brother. I completely understand that. Before we had trackers, we had calendars, and we all knew when our period was coming. We might have known all the
I was about to
things.
say, we have a little workbook that we're going to be giving out at the end of this that Imari created, that will be a paper copy that you can print out or you can use digitally, on your own without anybody watching, that you can use, and just do it old school, because sometimes a pen and paper is the easiest, right? And so we do have that option as well. But like Dr. Kelly said, we used to just have that calendar out. So if that's the way you need to do it, then that's fine too.
I think we have a question in the chat about cycling and knowing your cycle postpartum.
Yes, the question is, as a postpartum breastfeeding mom, I have not had a menstrual cycle since before pregnancy. Can I still track my menstrual cycle or ovulation? Whoever wants to answer that is welcome.
Can you just say how long postpartum you are?
Yeah, how far out?
Shani, you said you had your hand up.
Well, I was just
You went on mute again.
Oh yeah, her audio just cut out.
I'm sorry. Miss
Oh, there you are.
You got
Nope,
it.
there you are.
There's this idea that comes with postpartum that says, okay, well, while you're nursing, you can't get pregnant. And that's not true, because and what gets us in trouble is not knowing what your ovulatory signs are, because you will ovulate before you bleed. So maybe your period was about to come back, but you are not resting in the postpartum period, maybe like you're supposed to. That's a whole other topic. And so you didn't notice the egg white cervical mucus, right? You didn't notice all these signs that say, I'm ovulating, and now we're pregnant. So the thing about not getting your period, in Chinese medicine, we say 3 months after you should be looking at getting your period, 90 days. If you're going longer than that, because of the relationship between breast milk and blood, if the body doesn't have enough blood to bleed, the body's not gonna bleed. It's going to make a priority, right? And if we're making milk, maybe the body has determined that that's a priority. And so it's going to take that blood that may have been shed in the uterine and the endometrial lining and release it as milk. So
The
that's,
milk is made from your blood.
yeah, it's a weird way to think about it. But even I was having a conversation with someone at UCSD and their new lactology study thing that they're doing, and they're seeing connections as well, and so in Chinese medicine we think if you have enough, then you have enough, and so it's kind of hard if you don't already know what your ovulatory signs are, but you can start tracking and seeing, maybe if you start taking your basal body temperature, maybe you'll start to see that plummet and be like, ooh, this feels a little off, and start relearning your body. Because sometimes pregnancy is a reset too, and can shift.
I would say every pregnancy is going afterwards. People are like, oh my God, my cycles are changed. Yep, it's going to change. Absolutely.
Hmm.
You had a whole process go on for 9 to 10 months. It's going to change. The other thing is that's why you see women that have had postpartum hemorrhage or severely stressful pregnancies or deliveries. That's a lot of times why their cycles don't come back as soon as they
Mm.
would have, because their
Hmm.
body is trying to replenish everything. The other thing is when you're lactating, that naturally the hormones, when you're lactating, there is a basically what it's doing is while you're lactating, it's keeping other hormone levels low so that you don't actually cycle and bleed. The other thing is you have to have a lining to actually bleed. So if you've been breastfeeding and those progesterone and estrogen levels are not, going up and down in your cycle, then you don't have a lining to bleed, and so you won't bleed. But like she was saying, we all say that 6 weeks exclusive breastfeeding, okay, you're probably going to be good. However, once you're out of that 6 weeks to 3 months period time frame, and especially when that baby starts taking
Fair
other types
game.
of foods and you're not exclusive, then you are at a
Open for
potential.
business.
And as far as you know, recognizing your cycles, it's the same thing people do with natural pregnancy planning. You're doing do the same thing. The basal body temperature, what's your mucus doing? What is your body doing? What's going on with your mind? What's going on with your breast? Are the changes? So all those same changes that you go through, you just have to be in tune with your body to be able to figure those out as well.
Thank you so much. Um, we will be sure, Dr. Kelly, I think you have a stop now. Thank you so much for coming. I have one more question I want to ask to Noemi before we close out here. Noemi, what are some simple grounding ways to nurture your body during your period or postpartum recovery and help you reconnect with your body's wisdom during your menstrual cycle?
Yeah, absolutely. So my perspective comes a lot from indigenous Mesoamerican practices in medicine, so Central America and Mexico. And what I've been taught and what I do with all of my doula clients is to really focus on bringing warmth back, because
Mm.
during childbirth and it's interesting because in Mesoamerica, the postpartum period and your period are treated very similarly in how you want to treat your body. And
Mhm.
so it's a lot of focus on bringing warmth back into the womb because you've lost blood. So that means eating not only warm foods, but foods that are energetically warming. Um, and making sure all your food is well cooked, easy to digest. Incorporating teas. Personally, I like cinnamon tea for this time. It's very accessible and it's very warming. Um, it's also considered a time where you really want to slow down, and it's more of a time to be going inward. And I think that's also why some of us get irritable during our menstrual time, is because we're not really supposed to be interacting so much with other people's energy because it's really, meant to be a time where we're going inward. And similarly with the postpartum, and in a lot of cultures, including my own, there's a time when you're supposed to actually not interact with the outside world at all during your postpartum. So the first 6 weeks, what we refer to as the cuarentena, is supposed to be staying indoors as much as possible, really limiting your exposure to the outside world because it's understood that you're very tender, very vulnerable during this time. You're still kind of in this liminal space in the way I've been taught, your spirit is going elsewhere to retrieve your baby. And so you're still kind of coming back into this dimension. And so really being in that protective cocoon-like environment is important. Physically staying warm, so not going out into the cold, staying bundled and in a way held is really important. And then I think both the postpartum time and your period are a beautiful time to reconnect with the earth. I think of, when you lose blood during childbirth and during your period, it's an offering to the earth in the way that I understand it. And so it's really a reminder that we're not separate from our Mother Earth, and that we're a part of her. And then similarly with the question about honoring your cycle, it's a it's a beautiful way to remember that we are part of nature's cycles. So connecting with the cycle of the moon is one way to honor that. A lot of people tend to either bleed or ovulate with the full moon, and then some people will snake, so they'll during one part of the year bleed with the full moon, and then throughout the year it'll move, and they'll later bleed with the new moon. And so staying connected to the phases of the moon and how they are affecting your cycle. I know people feel differently about the apps, but I have an app that I like called Stardust, where it actually will show you your cycle and the phases of the moon. So you can see what phase the moon will be in when you're ovulating or when you're bleeding, and using that wisdom to kind of yeah, know what how to treat your body and what kind of capacity you might have during certain times of your cycle.
Thank you for sharing that wisdom with us and the app
Mhm.
recommendation. Um, I think that's all the questions that we have for our panelists. Imari, is there anything you want to add? And then I'm going to share my screen to put the information, the contact information up for everybody.
Well, I wanted to just really thank you all. Sade, thank you so much. You're so amazing. I'm so grateful for you. Thank you, Dr. Shani and Noemi. And I know Dr. Kelly had to leave, but I'm grateful for you guys for your willingness in coming to share this amazing, amazing wisdom. You guys gave us a lot of homework
Yes.
today. And really, I also want to thank everyone who joined. This would really be nothing without your presence and your attendance. So I really pray that you learned something today, and whatever that something may be, that it's just right for you. Thank you all.
Thank you. Thank you, thank you, thank you to our panelists for attending. I know Dr. Kelly had to leave early. Thank you, Noemi. Thank you, Dr. Shani. The contact information, websites, and I believe these are Instagram handles are available to you to reach out to the panelists individually if you'd like to. And then the three organizations that came together today to bring you this webinar are at the bottom, the San Diego Lactation Equity Alliance, the House of Women Wellness, and the San Diego County Breastfeeding Coalition. So thank you all for being here and spending your evening with us. I hope you all have a great rest of your night and stay in touch with us. Follow our newsletter and our Instagrams for more, because I'm sure we will be doing another webinar, probably a little mini series, like I said, on this whole menstrual cycle business. So thank you, thank you, thank you.